Welcome to Psychology Matters. We're glad to have you again today. Today we have a special guest. We've met you before, Dr.
Yes.
Susan Leahy,
Glad to be back.
and we're going to be talking about family, difficulties in the family. I think we can all relate to that. I know I can. We all come from families. And you work a lot with families in the counseling therapy world.
Right.
So I remember you're a licensed marriage and family therapist.
That's right.
And I have that kind of a license, so we end up seeing a lot of families. I think that you teach this course in a
do.
graduate program, how to work with families. Is that right?
That's right. That's right. I teach, I'm an educator, as I had mentioned in previous episode, at Trevecca Nazarene University, and I actually teach a course once a year on family therapy, helping students that are wanting to be marriage and family therapists learn how to work with families. And, you know, really honestly, my passion for that comes from my love of working with families. I remember back when I first started training myself to be a marriage and family therapist, working in the addiction field with family members of addicts.
Because it really does impact the other members in the family,
That's right.
Yeah.
That's right. So that's where I had a lot of my work and interest, which will pull into the work that I do now. But very, very passionate about working with the family, helping the family, not just helping one person, but helping everybody.
So I can imagine, and I know, there are so many issues that can come up with family, and it would be really easy to point fingers and blame a person or to have a scapegoat in the family where it seems like that's the problem.
Right.
For example, what's a good example of that? A scapegoat when we do that sort of a thing in our families.
Well, it's interesting. I'll tell it in a story
Okay.
because, you know, we shared someone that mentored both of us together, and so this is part of her story as well. That, you know, sometimes a family might present for counseling, for therapy, and they present and will say, usually a parent, sometimes to my child or my son or my daughter, they're having all kinds of problems,
Right.
whether at home, not listening well, having issues at school, maybe getting in trouble, and they say, fix them, make them better.
Almost like dropping them off to your office.
That's
Now
right.
do your magic and I'm out.
That's right. And so I, in the field that I'm in, and we might talk about this more, like to reframe situations. That
Right.
if I have a picture of what's going on, I like to put a different frame around it.
Right.
And how I view it is, it's not so much that one person's struggling, but it's more of a sign that maybe the family's struggling.
Right.
So this mentor we had in common, right? She would sit with someone and she would look at that child or that minor and say, wow, it's pretty remarkable that you were able to get everyone to come in here. What did you do to get your whole family in
Wow,
the
yeah,
same room at
yeah,
one time?
Yeah, yeah. That's a great reframe.
So what happens is, rather than that person being the problem, or like you said, the scapegoat, it's actually more of a sign of maybe bigger issues or what else is going on.
It's like I had to act out, I had to get attention on
Right.
me, I had to do all these things
Right.
just to show that there's a problem, and so the family ends up in a counseling office.
That's right.
Okay.
And, you know, honestly, in my experience, people don't always know that the whole family can come in.
Yeah. Oh, yeah. You know, and I don't know about you, but I think it's really amazing when we can get parents more involved rather than this idea of fix my child.
Right.
And sometimes, I remember you said this once, often you'll meet with the parent first
That's right.
to
That's right.
uncover that possibility of being able to help the parent with the child.
And what I try to do, I try to be very careful, because I don't want a parent or a guardian to ever feel like they're making mistakes or they're
Right,
doing something
right.
wrong. So the perspective that a marriage and family therapist or a family perspective would take is that it's not one person, that everybody, basically I'll say it this way, licensed marriage and family therapists, systemic clinicians treat the family, treat the system. We're working with the relationships and the interactions between people rather than the specific presenting issues.
So I seem to remember a story, maybe it was this mentor that shared the story of having a case where the little boy, he was a young boy, started having failure in school. He was a good student.
Right.
He was not engaged in school. He was acting out. He was having trouble at home. And the parents brought the child in to her to fix.
Right.
And she started asking some questions, probably questions like you would ask. What's been going on in the family? And I don't know if you remember this case, but it
I'm
seems...
not
Well,
remembering.
the case, the situation was that a few months prior to that, his brother had been killed in a car accident.
Ah, right.
It's so easy to miss, isn't it, if you don't have that perspective of what's going on in the family and what those
right.
dynamics are, right?
Well, in the technical word, we would call it context,
Right.
where it's really what a marriage and family therapist would do to try to understand the whole picture. I like to sometimes in my own words say it's all connected, that it isn't just the child's behavior or it isn't just the parents feeling frustrated. And we're bringing up that example because frankly that's a very common presenting issue. If I have someone that comes to me for counseling, tends to be, you know, my child or my teen is having problems, can you help them to feel better? Sometimes it's, can you fix them? Sometimes it's, I don't know what to do. And then when I say, well, what if everybody came in? People look at me in shock.
Yeah.
Because they're not even aware of it as an option.
Yeah. And I don't know about you, but it seems like when families do come in, regardless of who in the family
right.
seems to be the one struggling the most, when they come in, they often find a way to talk to one another in a new way. And it's a big relief.
I actually find that a lot, and like I said, I think some people don't want to be blamed.
Right.
So help my child, treat my teen, I don't want to be blamed for what's going on. And another reframe I often use is, to me it's an empowering moment where you have actually more influence over the situation. If you just hand off your child and say, make them better, you're putting the power in my hands. I say, I don't want that kind of power.
Right.
You can do this. I put it back in the parent's hand. We're going to work together with the whole family, not just to make maybe their behaviors or symptoms go away, but to improve the entire family's functioning.
Such a relief. I wish we had had that when I was growing up.
Isn't that the truth? That is the
Or if we
truth.
did, we didn't know that we had it. So let's just think of some different issues that families could have. Because I bet if we put our heads together, we could come up with quite a list, and I'm not sure that our viewers know the kinds of things that families come in to get help for. So what's one that comes to mind for you?
I can start with where I began with in my experiences. A lot of times I'll have families that come in where someone in the family is struggling with addiction.
Right.
And sometimes it's the entire family. Sometimes it's actually just one person. It's not uncommon to have a spouse of someone who's struggling with maybe alcoholism or drug addiction, or a parent of someone who's struggling. But sometimes the whole family comes in as well. So I see that as a pretty common issue, maybe because more people are likely to seek help at that phase because they're really pretty desperate. But that's a common issue that I see, addiction-related issues.
How about a couple of key ones like depression or anxiety? If you have someone who suffers from some form of depression, do you think that that impacts the entire family?
Absolutely. I can use an example. And I always say this, if I talk about an example, there's details and everything's changed. So it wouldn't be anybody that anyone knows.
yeah.
But if for someone's...
And you guys, you could never figure it out. If you think you know who we're talking about,
right.
we've changed it, you wouldn't.
But someone that presents, maybe there's a teenager that has been suffering in school. Maybe they were a straight A student, and they were struggling in school within the last 2-3 months, pretty withdrawn at home, maybe some additional conflict with one of the parents. You know, maybe the parents are struggling in their relationship. They, you know, one of them says, I think our son's having issues, he needs help. The other one's like, he's fine, he just needs to get over it. And then maybe there's another child in the family who is being perfect.
The perfect child.
The perfect child, because everyone else is struggling. And so maybe this family presents and they don't even know what to say is going on. Well, the source might actually be depression for that teenager, but nobody knows what to name it. And part of how we know that is if there was a pretty dramatic change pretty quickly, but then what you see is the parents' relationship is struggling, they're arguing more.
Right.
The one sibling maybe has more anxiety because she's trying to, what we would say, overfunction. And sometimes when those families present, it's hard to know where the issue is. And sometimes people want to know why or what's going on. I always say the good news is it's impacting everyone so we can create change with everyone.
Oh, yeah. Oh, yeah. That really takes the sting and the stigma out of it, and nobody's being blamed particularly. Like, all families have to deal with different issues. I mean, there is no perfect family. There is no perfect family.
And oftentimes people don't really know what's going on. You know, I think by human nature, we try to get answers to why or what is happening. And so people will come to a counselor and say, tell me what's going on, what's happening. And, you know, the good news in treating the whole family, you don't have to know the source. Change in one part can actually help create change in other parts.
Right.
Sometimes I'll use the illustration if I make a cake, if I have a recipe, and I leave one ingredient out, the whole outcome is changed. I remember seeing this picture online of 12 different chocolate chip cookies, and they were all made differently. One had brown sugar, one had butter, one had regular sugar, one had flour, and they all looked different. So sometimes I'll use metaphors like that with clients, that all it takes sometimes is to change one part of the recipe to make change in the whole family.
That's pretty amazing, and that's really the way a systems therapist, a marriage and family therapist is trained, because you're looking at the whole picture, the whole family, the whole story. And I don't know about you, but sometimes I think about it as, and I'll encourage each member, it only takes one to change, remain true to that positive change, and something's going to happen. We don't know exactly what's going to happen, but it's going to change the whole system.
Which is so good. And sometimes, though, the tricky part of what happens, so family comes and sees you, one part changes, and then everything else goes haywire.
Yes, and we have to prepare them for that possibility, right?
And the parents will say, what's happening? This is making things worse. And those are moments where I'll almost predict it for my clients, and in those moments they think I'm just the most wonderful thing ever, and I nope, I'm not. I just understand family functioning. We get really comfortable in how we do things.
Really comfortable in our uncomfortable zone.
That's exactly it. We get really comfortable in how we interact. So if I go home for a holiday and I've not lived at home for a long time, it's amazing how all of a sudden I'm acting like I'm 15 again.
Yes.
And it's almost like this force, this system's pulling me back in. And I think, why am I acting this way?
Yeah.
That's part of what happens with families and how they function.
Yeah.
That it's really difficult to do things differently. And so ultimately, we're trying to help families just create some change, which then can create bigger change.
Big change. Yeah. Now, I wonder how many times have you heard, wow, I'm so glad we came in. And sometimes it doesn't take very long.
Right.
Just working with all of the members together and sometimes pulling them apart.
That's right.
We do that. Do you do that?
I do. Yeah, I
like
do that
subsets
sometimes.
of the family and work with them and then bring them back together again. You do that as well?
Well, sometimes it's not uncommon for a family to present regardless of the issue. And sometimes they'll say, well, we wait to talk about things until we come into the office.
The safe room.
The safe room. And at the beginning, that's okay. But then what happens is I want to do what I say, push for change in the session and push for change out of the session.
Right, right. So we've talked about, the different kinds of things that can happen. A child struggling, depression maybe with one of the members or more, anxiety. Well, anxiety is it's a big one in families. One anxious one usually creates more anxiety, right?
Well, and there's different theories that we teach in school that look at anxiety a little bit differently. But along the lines of what you're saying, I think in some ways anxiety is contagious.
Yes.
It might impact people differently, but everybody feels that tension in some way.
Right.
And what we find is some family members will move away from it. They'll disconnect. Maybe you have a teenager who just doesn't come around anymore, or maybe someone who's really quiet or silent in the home. And sometimes other people really get up in the middle of it.
Oh, yeah.
Without a better way of saying it. They're a part of the chaos or the drama. What I find is both of those responses, whether backing off or getting involved, are people's attempts to try to make it better.
Yeah, yeah.
What we find though with families is neither works really well. It really just continues to perpetuate the issue. So we try to give people another option.
Right.
Another way to interact.
Right. Instead of reacting.
That's right. That's
right.
right.
I don't know about you, but I call it the autopilot, when we just react, being more intentional with what it is that we do. And someone like you or counselors, therapists like you are able to help explore those ways of working differently within the family.
Well, and sometimes even with anxiety, for instance, I'll use an example, that automatic reaction. I tell people, if you think about breathing, it's something we don't think about. Thankfully, our bodies breathe automatically.
Right.
But if we take the time to intentionally think about breathing, take things from the automatic to the intentional, that's when we really can help families see change.
Yeah, that's so powerful in families too. So powerful. So
can I add a piece?
Yeah.
An area of presentation that families have that I think they struggle with often. So if a family presents and say there's someone in the family struggling with a diagnosed ADD or ADHD, something like that, and if the parents think, well, why are we going to work with the whole family if they're the ones with the diagnosis, right? I see that happen. And the truth is, it's a real diagnosis with a real struggle, and a lot of those kids will get medicated, which is so helpful. But what I focus on is how the family rallies around it, how what the one person's struggling with creates positive or challenged interactions with other people in the system. So I really try to help explain people, remember, this is not a parent blame room.
Right.
We're trying to
empower.
help. That's a very good word, empower. We're trying to empower and help the family to function better around what's going on. Sometimes people want their problems to go away.
Oh, yeah.
And when I work with families, I say, the interesting thing, for some of you, they might go away. But for others of you, the problems actually may not go away, but your perspective and how you navigate those problems could actually improve quite a bit. And then people kind of give me that puzzled look. What do you mean by that?
Yes. Do you use family therapy as an educational forum for families as well, like providing them with resources, information on, let's say they do have one family member that's struggling with something, OCD or addiction?
I have a perfect example.
Okay.
I'd say where I use education the most is when blended or step families
yes.
present.
Oh, yeah.
So I'd say that's another common issue that families can struggle with. And there's things that we can do with therapies and techniques, but I find sometimes the most helpful is helping families to understand that it's challenging to blend more than one family together. And I think some families will interpret the difficulty as, well, this isn't working or there's something wrong with us.
Right.
In all reality, it's expected. So I use education a lot when it comes to the families that I work with that are blending.
So that kind of normalizes what they're going through.
Absolutely.
And so now the hopelessness is not there. They've got hope. Oh, we can do this.
Well, there's a person that a clinician, a well-known clinician that I show that. She has a video series and she works with blended families, and I remember one moment she looked at the father and said, or actually I think she looked at the stepmother and said, "You're the one that's on the line here. You're the one that's taking care of everything. But until this daughter figures things out with her dad, you're not going to be able to figure it out."
Right.
And it was such a poignant moment, because I think that's what happens, especially with families. You'll have one person trying to get everything to change, and they're the one on the line. And what we're really saying with families is we want to work with everybody.
Right. Right. This is so good. I just wonder sometimes how much the general public understands, family therapy and what family therapists really do.
Yeah,
it's not about going in and saying you're doing it wrong, this is how you should be doing it. It's more about getting to know each member of the family and how they work together, or what's not going well, and then taking on maybe a different perspective or looking at it through a little bit of a different lens.
Well, it's really interesting when you talk about, I think the general public doesn't understand maybe completely what family therapy is unless they've been there.
Right.
I find that I often have to explain to my family
what
family therapy is. And honestly, as we know, I teach and train students, I often have to explain to them what family therapy is.
Right.
When I teach students, sometimes the most nerve-wracking part is to, as I would say, sit with more than one person in the room.
Right. Right.
But the beauty of it, as I'm training my marriage and family students, they actually start, I know they're growing when they say this. It's actually less comfortable for me to be with one person in the room than multiple people.
Well, it makes so much sense.
That's right.
It makes so much sense, and the way I think of it is there's always something going on when you have a family in the room.
Well, if we're training people to treat the relationship or the interaction, it's much easier when the relationship's in the room.
You get to see.
That's right.
Rather than hear a reported perspective of what's
exactly
going on.
right. So that's always my encouragement to people. I can actually help you more, in most cases, not all, if the relationship's in the room rather than you just talking about it. And sometimes it actually happens a little more quickly.
So as we're closing, I want to ask you, do you ever get people who bring in in-laws? They're adults, and then maybe they bring in a parent or parents of one of the members of the marriage.
Well, it's very interesting. That's absolutely possible, but I'll find that's an instance where they may not come into the office, but we absolutely consider them as a part of therapy, whether I'm working with a couple or an individual. And if they come in and they're talking all about this other person that they're struggling with, right, which it's not uncommon in new marriages or as relationships develop, families grow. Families move through new relationships, they move into having young children, they move into having teenagers, they move into launching teenagers, they move into retirement, and each of those phases creates new change. new difficulties. And so I may not have someone able to bring an in-law in, but what I do is I'll normalize that there's an adjustment, a renegotiating. The relationship with your in-law, brand new when there's new relationships. It changes again when there's children added. It changes again when the children become teenagers. And so I probably have less people actually bringing in-laws in, but it's absolutely a topic of conversation that
And
comes
even
up.
adult siblings.
Absolutely.
Even adult siblings. And yeah. And
Sometimes what I might do is actually consult with a family member, get permission of my client. They might come in for a session or have a phone call to help me better understand what's going on with the person that I'm working with.
So if you were to like have one last statement, you know, for our viewers as to the benefit maybe of family therapy, is there something that comes to mind that you would share?
Well, it's really difficult because I think I could talk about this forever and ever
that's
and
why
ever.
that's why we invited you.
I think I could talk about this forever, but if one or two maybe benefits of family therapy, let me answer it this way. I think it takes a lot of courage to come and talk to a counselor, and it's one thing to talk about me. It's another thing to be in a room where someone else in my family is talking about me. That takes a lot of courage and bravery. And so one of the benefits of family therapy to me directly comes from that. If I'm willing to put myself in that space, I'm going to reap the benefit of change.
That's so well said. That's so well said. Thank you so much for being here today, Susan. You're just great. I know that
This
you
is
do
a
a
pleasure.
lot of work in family therapy, and we couldn't ask for someone better to be here to talk about family therapy.
Thank you so
So
much.
for our audience, we're so glad that you are here. We're glad that we get to share all about family therapy as we close out another episode of Psychology Matters. Thank you, and be sure to watch for upcoming episodes. We're glad to have you.